Robust evidence is essential for effective health programming and for guiding strategic decision-making for public health. To support evidence-informed actions, the Center for Global Digital Health Innovation at the Bloomberg School of Public Health has developed an evidence gap map, a platform that systematically presents existing research on digital health and helps identify areas where evidence is limited. This interactive tool is now hosted on the Implementome platform in collaboration with the Geneva Digital Health Hub. This tool enables health researchers, policymakers, and innovators to quickly explore three common questions these stakeholders use in their work. What types of digital health interventions have been studied? What outcomes have these interventions demonstrated? Where do we still lack sufficient evidence? Understanding the scientific evidence empowers researchers and policymakers to prioritize what has been shown to work for implementation, as well as identify where future investment in research is needed. This short video guides you through how to use the evidence gap map currently populated with digital health studies related to reproductive, maternal, newborn, and child health. Here, we see the gap map interface. The rows, or the y-axis, list categories of digital health interventions as per the WHO classification of digital health interventions, such as targeted communication to persons and healthcare provider decision support. The columns, or the x-axis, show outcome categories such as access, quality, efficiency, and more. Double-clicking on an outcome category reveals specific sub-outcomes, such as iron folate adherence and early initiation of breastfeeding. You can filter results by RMNCH domain, intervention type, country, or region. Each cell may contain up to 3 circles, color-coded by quality of evidence and sized by the number of studies. Clicking a circle opens a new window that displays the evidence for that digital health intervention's outcome, complete with study titles, summaries, and direct links to original sources. For example, in the case of provider decision support tools, no low-quality evidence was identified for their impact on the quality of services. If a cell is empty, it indicates a gap in evidence, indicating that we did not find evidence for the particular intervention. Let's walk through an example. Suppose you are a Ministry of Health official trying to decide which digital interventions in the antenatal period are most effective for improving access to care. Start by filtering by the RMNCH domain A and C, and you'll see that multi-component tools and targeted communication to persons or TCC tools are most frequently studied. Narrowing further to a region, say Southeast Asia, reveals that TCC is the predominant approach. Clicking on the access/timeliness outcome reveals more granular sub-outcomes. In each cell, we can see up to 3 circles, their colors denoting the quality of evidence and their size proportional to the volume of evidence. If you're interested in TCC's impact on tetanus toxoid, also known as TT immunization, you'll notice we have some moderate and high-quality evidence for it. Clicking the circles shows which studies support that data point. Beyond exploring existing evidence, this tool highlights critical gaps. For example, limited evidence exists on quality and efficiency outcomes. This helps stakeholders identify priority areas where targeted research investments can generate high-impact insights. In this way, the evidence gap map enables users to interrogate the digital health evidence landscape and identify priority areas for future research and investment. We invite you to explore the current evidence gap map to inform your work, share it with colleagues, and help advance more evidence-informed digital health programming. Our team at the Center for Global Digital Health Innovation is currently reviewing evidence on digital health interventions in other health areas, including non-communicable diseases, HIV, and tuberculosis, and will be updating the evidence gap map with these findings soon. We are also developing an AI-powered chatbot that allows users to query the gap map directly. Do watch this space for updates. We invite you to follow us on our social media platforms and sign up for our monthly research roundups for more insights and learnings.